Okay, I've gathered my equipment, knock knock, washing hands, providing privacy. Hi, my name's Don. I'm going to be your student nurse today. Before I get started, can I get your first and last name and your date of birth?
Anna Scott, March 24, 1991.
Okay, thank you for that, Anna. I'm just going to clarify. Perfect. So Anna, are you comfortable?
Yep.
Okay, what brought you in today?
Wellness check.
Wellness check. Okay. And then what's your pain level today? Or are you in any kind of pain today?
No.
Okay, and do you have any spiritual or cultural beliefs that I should be aware of?
Mm-mm.
No? Okay, and do you know where you're at and how you got here?
I'm at the hospital. I drove here.
Okay, and do you know around what time it is and around the day?
It's around 2 on Wednesday.
Okay, thank you. And then what do you identify as and what's your heritage?
Hispanic female.
Okay, and what's your primary language?
English.
Okay, thank you so much for clarifying all that. I'm going to go ahead and measure your vitals. I'm going to go ahead and step out real quick, and then I'll be right back.
Okay.
Okay, stepped out. I have Anna. She's a female. She identifies as female. She's English speaking, and she has no cultural religious beliefs that we need to be aware of. And her vitals are all normal. She's in no pain. She's here for an annual checkup. She's alert and oriented to time and place, and she has no slurring of the speech. She's able to hold conversation well. Doesn't seem confused at all. Her posture is erect and no contractures present or stooping. And she is dressed appropriate for the occasion. She has good hygiene. And next I'm gonna come in, knock knock. Hi, I'm back. I'm gonna start your head to toe assessment. Can I just go ahead and I'm gonna go ahead and begin with your skin. Before I get started though, I want you to remember these 3 words. Repeat them back to me. Gray, carpet, couch.
Okay.
Can you repeat that back?
Gray carpet couch.
Okay, thank you for that. So can I just go ahead and get your hands? Okay, so skin color is even and normal for heritage. It is warm to touch, normal dry. Capillary refills is less than 3, no signs of jaundice. Skin turgor is less than 3. No signs of eczema, open sores, lesions, or bruises. No skin breakdown. Can you go ahead and grip my 2 fingers? Can you go ahead and squeeze as hard as you can? Okay, and then pull towards yourself. Okay, and push towards me. Okay, perfect. Thank you so much for that. And then can you abduct your arms out? Okay, and retract them, and then forward and back down. That cause you any kind of pain?
No.
Okay, so her grip and her push-pull is bilaterally equal and strong. I'm gonna go ahead and check her radial pulse. It is bilaterally equal and strong with a good rhythm. So next, I'm gonna go ahead and assess your head. Before we get started, do you have any contact lenses, glasses, prosthetic eyes?
No.
Okay. And have you had any problems with your smell or taste?
No.
Okay, and any head trauma or anything that I need to know about?
No.
Okay, so I'm gonna go ahead and I'm gonna assess the scalp, noting that the hair is thick and healthy. Let me go ahead. And the scalp is shiny and intact. No signs of bruising, scars, open ulcers, lesions, or any signs of trauma. The head is normal, round, cephalic, midline. Can you go ahead and smile and stick out your tongue, waggle? Okay, perfect. No sign of facial drooping, facial edema. Can you go ahead and close your eyes? Open them. Okay, no signs of ptosis. So next, I'm gonna go ahead and assess your eyes, Anna. I'm going to note that the sclera is clear, white, normal. The conjunctiva is conjunctiva is pink, moist, normal, no signs of drainage, no signs of ptosis or jaundice. And have you had any hearing problems recently? Okay. Any hard time seeing?
No.
No? Okay. So I'm gonna, if you can follow my finger without moving your head to your eyes. Perfect. Okay. Cardinal field is normal. So next I'm gonna go ahead and just assess your eyes. Okay, perfect. And follow my pin. Okay. Eyes are perla. Pupils equally round and reactive to light with good accommodation. So next I'm going to go ahead and assess the ears. I'm going to go ahead. I see that the canthus of the eye is aligned with the tip of the ears. Not seeing any drainage or obstruction, no signs of trauma. And I'm going to go ahead and perform a whisper test real quick, check your hearing. Just go ahead and repeat what you hear.
Denver Broncos. Broncos roll.
Okay, hearing is good. So next I'm going to go ahead and I'm going to assess your nose. So no problems smelling, correct? Okay, I know the mucosa is pink, moist, normal, no septal deviation, no signs of congestion or drainage. For your mouth, do you have any dentures or anything? Any fake teeth? Okay, perfect. Any bleeding of the gums, sores, anything of concern? Okay, if you can go ahead and open up and stick out your tongue. Okay, put your tongue back in. Okay, so all teeth are intact. No signs of halitosis. Uvula is midline. Intact. Tonsils +1. So next, I'm going to check her trachea. Can you go ahead and swallow? She has good swallowing accommodations. Her trachea is midline intact. No tracheal deviation. No neck vein distension. And no accessory muscle use. Can you go ahead and push against my hand? Okay, and next head. Okay, perfect. Now can you look sideways, both ways? Okay, go all around. Okay, any pain?
No.
Okay, full range of motion. So next I'm going to go ahead and assess the breast. Have you ever had a mammogram?
No.
Okay, I'm going to assess for symmetry of the breast, looking for any nipple drainage, any sores, lesions, any skin breakdown or rashes under the breast. And so, have you ever had a breast exam?
No.
Okay, so do you know how to do a self breast exam? Okay, so normally for a female, you want to do it 4 to 7 days after the start of your menstrual cycle, once a month, going in an up and down motion, just checking for any abnormal lumps or tenderness. Make sure to get up in the axillary area, and it's best to be done in the shower or in front of a mirror, so you can forward and side to side, just checking everything. And I note that there's no lumps or tenderness while I was checking. So next, I'm going to go ahead and assess your lungs. For your lungs, have you had any shortness of breath, any cough, no labored breathing?
Nope.
Okay. And I assess she has no cyanosis, no labored breathing. So it doesn't look to be in any kind of distress. So I'm going to go ahead and start, if that's okay. Before I get started, I'm actually going to, can you go ahead and raise your shoulders? Okay, perfect. Can you lean forward real quick? Okay, can you go ahead and breathe for me? Lung expansion is bilaterally equal, and for expansion and collapsing of the lungs. So I'm going to go ahead and assess your lungs real quick. Okay. Okay, 1, 2, 3, 4, 5. Okay, if you can go ahead and lean forward, please. Okay. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 9, 8, 9. Okay, there's no advantageous sounds, no wheezing, rails, crackles, bronchi, stridor present. So next I'm going to go ahead and I'm going to assess your heart. Have you had any chest pains or anything? Okay. Do you feel like you've had any irregular rhythm or anything? Okay, so. Okay. Okay. So I'm going to the second intercostal on the right side, listening to the aortic mid-sternal border, listening to the aortic valve. Going over to the left side for the pulmonic. Second intercostal sternal border, listening to the pulmonic, and then I'm going to go down to the fifth intercostal mid-sternal border, listening to the tricuspid valve. And then I'm going to go over to the fifth intercostal mid-clavicular line, listening to her mitral valve, staying there for 60 seconds. Okay, I'm noting S1, S2, no extra S3, S4 sound, no signs of tachycardia, no signs of heart murmur, and her heart rate and rhythm is equal and strong. So next, I'm going to go ahead and I'm going to assess your abdomen. If you can go ahead and lay down for me.
Yeah.
I'm going to go ahead. Have you had, what's your diet like?
Good.
Okay, have you had any diarrhea or vomiting?
No.
Okay, have you had any abdominal issues, stomach cramping, any tenderness, felt any lumps? Okay, and have you been constipated?
No.
Any bloody, dark tarry stool?
Mm-mm.
Okay, frequency of urine, is your incontinence good? Your urine, okay. So first I'll inspect, noting that the stomach is flat, no pulsating. And then I'm going to go ahead and so no pulsation. So then I will go ahead and I will auscultate, starting at the right lower quadrant, listening for vowel sounds. 1, 1, 2, 2. There's no hyper or hypoactive vowel sounds. Sounds normal. Go start with the light palpation, going around. Okay, and then I would do a deeper palpation. I'm noting that there's no guarding, no tenderness, no bruises, no lumps, no pulsations, and no tenderness. Next I would percuss, and I would, over the airfield organs, it would be a tympanic sound, and over the solid organs, it would be a dull thud sound. And so next, I'm gonna, and we do that just to know the size and the whereabouts of each organ. And then so next, I'm gonna go ahead and check the urinary. For male or female, I'd be checking if there's no vaginal or penile discharge. And then when was your last pap smear?
A month ago.
Okay. And then for a male, a testicular exam once a month. In the shower, making sure you get all areas, feeling for any tenderness or abnormal lumps. I would be checking for the perianal, any perianal breakdown, any hemorrhaging, and have you had any problems?
No.
Okay. So then next, I would go down to musculoskeletal. Can you go ahead and raise your right foot for 3 seconds. Put it down. Next foot. Okay. Go ahead and push towards me like a bath bell. Perfect. And towards yourself. Perfect. Check on my capillary refill is less than 3. No signs of jaundice. Checking for edema. No contractures. Checking the pulse of the dorsalis pedis pulse, the posterior tibialis pulse, and the papillary pulse. All are bilaterally equal and strong with a good rhythm. And then I would ask you to sit up, please. Okay. So have you had any issues remembering?
No.
Okay. I asked you three things. Do you remember what they were?
Gray couch and carpet.
Okay, perfect. Short-term, long-term memory is good. Papillary reflex is still good. She's still alert and oriented. No signs of dementia. No signs of Alzheimer's. She's able to hold a conversation well. She's able to answer well. Her thought process is good. She doesn't seem to have any irrational thoughts. No agitation. And cranial nerves 2 through 12 are good. Again, grip, push, pull. All bilaterally equal and strong, and with full range of motion. And next, I'm going to go ahead and I'm going to ask, and the papillary reflex is also good still. So next, I'm going to just ask I'm going to check her if she has an IV. I'm going to check the patency of the IV. I'm going to check the site for any redness, swelling, any drainage, any signs of infection. I'm going to check, make sure the flow rate is good. And then I'm going to go and I'm going to check to see if she has any catheters, any food tubing, any nasogastric tubes, jejunum tubes, anything. Any suctioning, and making sure that it's placed correctly, and for a catheter strapped to her or taped to her leg. I check again, the urine. I check the urine for clarity, appearance, smell, and then also the output if need be. I would check for oxygen. Is it nasal cannula oxygen, or is it a mask oxygen? How much is she receiving, and how frequent is she supposed to be receiving the amount? Make sure that there's no signs of distress, cyanosis, anything like that. And that completes my head to toe assessment.